Hey Felicia, this is Jensen, your lab partner. I just wanted to try something a bit more experimental. So I'm going to make a video feed of an auditory reading of what I've written so far. I'm going to email it to you still, so you'll have it either way. So let's just see how this works. Alright, so over the past week or so, I've set up voice recognition, so my computer will be able to recite virtually anything. So, well, let's just go ahead and see if it works. So, Crystal. Highlight full page. Make selection audible. Recite highlighted section.
There are three major maxillary nerves. The first is the posterior alveolar nerve, or the PSA nerve. The anatomy of the PSA is such that the PSA nerve branches off the maxillary nerve posterior to the maxilla. It travels inferiorly and enters the posterior maxillary, where it sends three branches to the three maxillary molars. Anesthesia technique. The needle penetrates the crease between the cheek and gingiva opposite the last molar and deposits anesthetic behind the maxilla near where the nerve enters the bone. Middle superior alveolar nerve, MSA, anatomy. The MSA nerve branches off the infraorbital nerve, which is a continuation of the maxillary nerve, and descends and branches to provide sensory innervation to the premolar and mesial root of the first maxillary molars. Anesthetic technique. The needle penetrates the crease between the cheek and gingiva opposite the second premolar and deposits anesthetic near the root apex of the premolar. The solution spreads to get all the branches of the MSA. Anterior superior alveolar nerve, ASA, anatomy. The ASA nerve branches off the infraorbital nerve near the infraorbital foramen and sends branches to the incisors and canine. Anesthetic technique. The needle penetrates the crease between the lip and gingiva on the mesial side of the canine. Mesial is the oral equivalent of medial. Anesthetic is deposited above the canine root and involves the branches also to the incisors. Mandibular nerves. Inferior alveolar nerve, IA, anatomy. The inferior alveolar nerve branches off the mandibular nerve, which is a branch of the fifth cranial nerve, or trigeminal nerve. It descends along the medial side of the mandible and enters the mandibular bone through the inferior alveolar foramen. It travels in the inferior alveolar canal, giving off several branches to all the mandibular teeth on one side. Anesthetic technique. The needle penetrates the cheek halfway between the maxillary and mandibular teeth and lateral to the pterygomandibular rapha 1/3 of the way between the anterior and posterior borders of the mandibular ramus. The needle penetrates about 25 millimeters, 1 inch deep, and anesthetic is deposited near where the nerve enters the inferior alveolar canal. Lingual nerve, or LN, anatomy. The lingual nerve branches off the mandibular nerve above the inferior alveolar foramen and supplies innervation to the tongue and lingual gingiva. Anesthetic technique. The needle penetrates the cheek in the same place as for the inferior alveolar injection. It only penetrates about 12 or 13 millimeters, 1–2 inch, where anesthetic is deposited near the lingual nerve.
Okay, so that's it. So I hope this all works out and you get to see this. All right. See you tomorrow. Or today. Who knows?